Most fertile period. Determining your fertile period. The most fertile period is that period in a woman's life when her chances of getting pregnant are the highest. Each month during ovulation the ovary releases an egg or ovum that travels down to the mouth of the fallopian tubules. It is crucial that the woman makes love with her partner prior to ovulation or perhaps even after ovulation. If sperms are present in the uterus when the woman ovulates, fertilization occurs, leading to pregnancy. Many couples do not understand the concept of the fertile period, so in some cases accidental pregnancies occur and in others delays in getting pregnant. How to determine the fertile period? To determine the fertile period of a woman, it is necessary to study and analyze the menstruation cycle. It varies between 23 and 35 days among women, and many classify the cycle into two parts: before ovulation and post-ovulation. The first day of the period is called day 1. During day 7 the ovum is getting ready for fertilization, and during day 7 to day 11 the uterine lining thickens, getting ready for the implantation of the fertilized ovum. During day 14 the ovum is released and it travels down the fallopian tubules. If a sperm is waiting for it, the ovum is fertilized and implants itself in the uterine lining, resulting in pregnancy. The ovum has a lifespan of only about 12 to 24 hours. Sperm can survive up to 72 hours inside a woman. In the event that it is not fertilized, the ovum breaks down and is shed along with the uterine lining during day 25. If you wonder, are you fertile right before you're going to start your period, you are right. You are most fertile 14 days before the onset of your period. You can calculate fertile period by noting your menstrual cycle pattern as well as by analyzing the basal body temperature, changes that occur in the cervix mucus, saliva tests, noticing minor changes in your body such as abdominal pain during ovulation, etc., and by examining your cervix. During ovulation the body temperature increases by 0.5 to 1.6 degrees, which if the temperature is taken systematically, it can help identify your fertile period, and if you and your partner make love during the fertile period, your chances of getting pregnant is higher than random lovemaking. During ovulation the cervix mucus is clear and stretchy, unlike other days when it is pasty and thick. The saliva test is also preferred by some to determine the fertile period. Some people examine the cervix. If you find it open, then it indicates that you are fertile, whereas if it is not your fertile period, it may be closed. If you determine a woman's most fertile period, then half the battle is won as far as getting pregnant is concerned. The fertile time periods for women vary among women, so study your pattern before you start your pregnancy planning. You can use tools such as the Ovulation Predictor Kit, ovulation calculators, etc. to note and analyze. At times women may have spotting during fertile period. This makes it easier for the women to identify their fertile period. Many couples are stressed that they are not conceiving despite trying so hard. The secret is to stay stress-free and relax, as stress has an adverse influence on ovulation. Fertile period calculations are ideal during the pre-pregnancy planning stage, as they will help you get pregnant faster. Eat healthy, stay stress-free, exercise regularly, stay drug, alcohol and tobacco-free, and once you calculate the fertile period, make sure you are active sexually during the period. Read some good books to help you learn all you can about fertility periods, pre-planning pregnancy and childbirth. When is the best time to get pregnant? When it comes to pregnancy planning, there are 4 major check marks you need to make before you're ready to have a baby. When all of these requirements are met and the timing is right, you've found the best time to get pregnant. Many of these things can be handled in your pre-pregnancy planning process. The first way to tell that it's the right time to get pregnant is that you have a strong relationship with your partner. You and your partner will have to make many decisions and compromises as you become pregnant and as your child grows. The only way to be sure that you can make it through these trials and tribulations is by having a strong relationship in the beginning. If you aren't ready to commit to this person for the rest of your life, you certainly aren't ready to bring a child into the world. The second thing to consider is finances. You need to be able to handle the expenses involved in becoming pregnant, having the baby and raising your child. Make sure you have good insurance to help cover the high costs of having a baby. You should also make sure that you have good savings in order, especially if you work a full-time job that you'll need to leave for a short period of time after you have the baby. Consider also whether or not you have the disposable income required to purchase all the items you'll need for your baby. The third thing to consider when deciding if it's the best time for you to get pregnant is your personal health. You can check with your doctor to make sure that your health is stable, and that no alterations to current treatments need to be made in order for you to have a healthy pregnancy. Finally, when you know you're ready to have a baby, you need to determine the best time to get pregnant. This is usually done using a variety of methods. Women generally ovulate about 2 weeks into their menstrual cycle. Therefore, if you have a normal 28-day cycle, the best time to get pregnant is on the 14th to 16th days of your cycle. If you want a better picture of when your best chances of conceiving are, you may want to purchase a basal thermometer. Your basal temperature will go up about 1/2 to 1 1/2 degrees when you ovulate. You may also notice as you start monitoring your cycles more closely that you actually cramp a bit when the egg drops, letting you know immediately that the timing is right. You can also tell by testing the elasticity of vaginal fluids. Your doctor can give you more information on tracking your fertility using any of these methods. You can, of course, go really high-tech and be absolutely certain of the best time to get pregnant by purchasing an ovulation kit. These kits come with everything you need to determine when you're ovulating. These kits take all the guesswork out of the equation, and allow you to get pregnant much faster than by guesswork alone.